At the State House, it is a public policy war largely invisible to patients or the public. But eye doctors have been locked in an ongoing legislative battle over who can be certified to perform certain laser procedures.
What we're talking about are 3 in-office procedures. These are not cataract surgery. They are not LASIK. They are not done in an operating room. They are not done with general anesthesia. They're done in an exam room just like this.
Dr. Angelique Sawyer says 14 other states already allow optometrists like her to be certified for this trio of laser treatments for cataracts and glaucoma listed in House Bill 349.
These procedures have been performed safely by doctors of optometry in these other states for more than 40 years. There have been studies that have shown that over 146,000 of these laser procedures have been done by doctors of optometry with no increase in rate of complications.
Ophthalmologists trained in surgery say it's not that simple.
The big concern is with patient safety, and this is going to allow eye care professionals who are not trained in performing actual surgery to perform surgeries.
Dr. Kimberly Liccardi says operating a laser like this takes experience and training, and there can be complications.
Bleeding, post-operative inflammation, post-operative pressure spikes can last for weeks.
The ophthalmologists are now armed with a new UNH poll that claims to show broad public opposition to these changes. The last time lawmakers considered a similar bill, it ended up sidelined in the state Senate. But the broader dispute between eye doctors over who can do what never really went away.
When it comes to the point of actually passing a law and things changing, the tensions rise, and it's unfortunate that it has to be that way.
In Concord, Adam Sexton, WMUR News 9.